And it is setting up. Let's see. Okay, I think we're good. Awesome. Okay, people are still joining in. Okay, let's get started. All right. Good evening, everyone, and thank you for joining us tonight. My name is Ravina Nimbalkar, and I'm the Executive Director at NAMI Santa Clara County. And before we start with tonight's presentation, I'm going to go over some of the updates at NAMI Santa Clara County. So a helpline is up and running from 10 a.m. to 6 p.m. Monday through Friday via phone as well as email, as well as walk-in. You can walk in into our office from 10 a.m. to 2 p.m. Monday through Friday. Support groups are all listed on our website and offered over Zoom. And our website is www.namisantaclara.org. Our educational classes, such as family to family, familiar to familiar, persona to persona, peer to peer, provider education. For these classes, you can contact our helpline number, which is 408-453-0400, and select option 1. And you can get further details and get on the interest list for these classes. NAMI Basics is on demand, and you can visit our website and take it at your own pace. And so is NAMI Homefront. It's online, it's on demand. You can take it at your own pace. The next FaithNet Mental Health 101 training is on August 17. If you want more information, you can call a helpline number for that as well. The community peer program continues to match via hospitals as well as self-referrals. And you can find more information about a community peer program as well, and also call a helpline. Okay, so the NAMI Walks kickoff is coming up. It's on Sunday, June 25th at Kelly Park in the Family Circle area. And to RSVP, you can go to our website, www.namisantaclara.org, and on the front page itself, there should be an invitation and there should be a link to RSVP. I just want to let everyone know that when you RSVP, you can only RSVP for yourself. So if you are bringing in a guest or a family member, you'll have to RSVP for them as well, because we want names of every person coming in, because there's going to be a registration check-in, and so that's what we do. And the NAMI Walk Silicon Valley is on Saturday, October 7th, and it's already June. Can you believe it? So it's the countdown has begun. And our keynote speaker for the NAMI Walk Silicon Valley is the president of the 49ers. His name is Parag Marathe. And our honorary chair for the NAMI Walk Silicon Valley is Supervisor Cindy Chavez. Okay. So now that I have these updates, I've already announced these updates, let's move on. So our speakers today, that is Shalini Arora and Sonali Parnami, and they'll be focusing on learning about your mental health rights. Mental illness is more prevalent than most people realize, and recognizing there is a need for mental health services and hearing the difficulty many are facing in accessing services, the health system, NAMI Santa Clara County, and Bay Area Legal Aid developed a presentation to educate our community about the rights to access medically and necessary mental health care. So the presentation explains how common mental health conditions are and how to recognize signs and symptoms. It provides information on rights to care, steps and resources to access care, and what to do if you encounter problems. Sharing the presentation will be Shalini Arora and Sonali Parnami. Shalini is a senior staff attorney at Bay Legal Health Consumer Center. And she is also a registered nurse and practiced nursing before joining Bay Legal. She's fluent in Hindi and Punjabi. And Sonali Pranami is a program manager at the County of Santa Clara Health System. She is a public health professional who's passionate about policy and meaningful impact it has on improving the health and well-being of individuals and communities. I'm going to hand it over to Shalini and Sonali now. And I just want to share that feel free to post all your questions in the Q&A section you see down below. And in the chat sections, feel free to have any comments and just if you want to say something, but it's just easier for us to navigate the Q&A if you put them in the Q&A section. I'm going to hand it over now to Shalini and Sonali. Over to you.
Okay. Thank you so much, Ravina. It's really nice to be here presenting to all of you today. And so we really thank you for allowing us to be at this general meeting and share what we're sharing with the community. So as Ravina actually provided a really great context in terms of how and why this presentation was developed. It was developed in with the recommendation that came out of the mental health parity work group. And both organizations, NAMI and Bay Area Legal, are a part of. So with the rising illness, the mental health illness, the group discussed what would the community most need. And so this really rose to the top that people needed to understand how to access care and understand what their rights were around mental health care. So I'll be tag teaming this presentation with Shalini. And before we begin, actually, we wanted to put, I will put a survey link in the chat, and we're going to do a pre and post survey. If you could take a few minutes to fill the survey out. It has demographic questions that are required by the state because we receive a little bit of funding. So they ask that we ask for demographic questions, and then also a little bit of like what the current knowledge is on some of the topics that we'll be discussing. And then at the end, we'll ask the same 4 questions again. And so I'll send another link and then have you guys take a post-survey questionnaire. And so as Ravina had mentioned, it was really this presentation developed for the general public and kind of with that frame of mind. And it's still iterative in its development process. So any feedback also that you guys might have, we're welcome to that. And you can leave that into the chat in the post presentation survey. Shalini, did you want to add anything before we begin? Oops, I think maybe on mute.
Okay. Yeah, you mentioned pretty much everything, and I'll take over and I'll talk more when we get to the legal part.
Okay, sounds good. So I'll give 1 or 2 more minutes and give people a little bit of time to finish the survey. Next slide, Shalini. Okay. Oh, you don't see the survey. You did not get the survey. Ooh. You don't see the link that I put in the chat? No. Hold on, let me post. Oh, I didn't share it with everyone. Thank you so much. Hold on. Let me do it again. Okay. Does everyone see that now? Great. Cool. I'll give a couple minutes. Thank you so much for pointing that out. Okay, so folks can continue filling that out. That would be great. And we'll just get started. Just a few things to note, like I mentioned, it is really developed for the general public. And I know all of you provide a lot of information to the community through your health line and through your other programs. So much of the information that I'll go over is probably some things that you already know and probably would do a much better job of presenting. So I'll very quickly go through my end of the slides. But also wanted to share in the context of this presentation that since most people get their insurance through a managed care plan like Kaiser, our presentation really just focuses on commercial insurance. We don't go into Medicare or Medi-Cal, although the Bay Area legal team is working on some FAQs to address that in the future. So that will be addressed because that did come up as questions previously. So today our goal is to help the community and folks like yourself understand what mental health conditions are and recognize signs, increase awareness of your rights and your loved ones' rights, and also help people understand the steps and the resources to be able to access care, including what to do if there are problems. And like I mentioned, it's really focused on commercial insurance. Next slide, Shalini. So we all know and agree, and it's widely known that we need to take care of our physical health. So we exercise, we healthy, we do preventative exams. It's very well known that, okay, we go see a doctor when we're sick. Next slide. And so similarly, as you all know, our mental health is very important for our overall health because it controls the way we think, the way we feel, the way we behave, and our mind enables us to think and communicate and cope with the daily stressors and also build our resilience. Mentally healthy people also feel emotions like stress and anger and sadness, and they know how to manage negative feelings. Next slide. And just like our body, our mind can get sick. So when this happens, it affects our day-to-day living, our ability to function at school or at work, and we call that a mental health condition, as all of you know. It can be mild or moderate or severe. It varies. And fortunately, mental illnesses are treatable health conditions. Next slide. Oh, actually, go back. What we really wanted to emphasize here is that mental health care is healthcare, mind, body, and spirit. And so really, that is the take-home message whenever we're talking about mental health care. Next slide. So as Rovina had mentioned on the onset of the presentation, it's more mental illness is more common than we think. Depression is the leading cause of disability worldwide, and in the U.S. alone, 1 in 5 people live with a mental health condition. And applied locally, that means that we would fill 5 Levi stadiums with Santa Clara residents that are living with a mental health condition. And here we also note that 1 in 6 youth of our youth are experiencing the symptoms at an early age. And so applied locally, again, that 68,000 youth that are 16 to 17 years old experience a mental health disorder in Santa Clara County. Next slide. So this data, this slide shows national data on adults and shows the mental health conditions affect all ages and all races. So as you can see here on the right-hand side, it's something that I found on NAMI's website, was that 50%, and it's very impactful to know that 50% of all mental health illness begins by the age of 14, and also 75% by the age of 24. On average, it takes 11 years for people to seek treatment from the time that they experience symptoms. And so this just emphasized why it's so critically important to make sure that people have opportunity for early intervention and help conditions from progressing. Next slide. When we say mental health conditions, these are the diagnoses that we're talking about, and there are many, including anxiety, depression, bipolar disorder are just a few. Next slide. So we share just some signs and some early warning signs of a mental health condition. Obviously, there's many others, but we already said that many start by the age 14. And many wait because they don't know. So if you take a look, these are some of the most common signs: drastic mood changes, seeing things that aren't real, thoughts of suicide. And when anxiety and emotions are impacting day-to-day living for longer than 2 weeks, and then it's really an indication to seek help. And always, as always, talk to a professional, talk to your doctor, seek a professional evaluation if you see if there's signs. And also we'll share later the resources, including NAMI helpline to call when you don't know where to go. So if you have a mental health condition, how do you access care? Next slide, sorry. Okay, next slide. So the next 3 slides show some important numbers that you can call. As you all know, and probably share this out in the community yourselves, is that calling, if you're experiencing a mental health crisis, or if you just need to talk, there's now the 988 number, which is the 911 of mental health care. So if you just need to talk to someone, or if you're looking for mental health services, a mental health counselor can answer your call, will answer your call and provide you with what you need when they answer. And if needed, they work to de-escalate situations by using trained mental health workers. I do want to point out there's a 1-800 number here, and essentially, if you call from a 408, 650, or 669 number, then you're directed to local resources. But sometimes our cell phones don't have those area codes, so you use the 1-800 number, and that will help you be directed to local resources in your area. If you know someone or you yourself need urgent walk-in care, you can use the behavioral health urgent care, and the address is listed here. And so if you do show up, they don't screen and they won't turn you away. So you can always use the behavioral health urgent care center. And then also emergency rooms are another option. But 988 is really what has grown to be the best number to call. If it's an emergency or life-threatening or immediate danger, you can call 911. You can also ask for a CIT officer, which is the Crisis Intervention Team officer, and they are police, but they've been trained on how to respond to mental health crises. Next slide. So to find a provider or to find treatment, if you're looking for a therapist or a psychiatrist, ask your primary care doctor to refer you. But again, it's not required to get a referral from your doctor. You can call a provider directly in your network. If you can also call your health insurance plan, and also what's not known is that you can ask for a care manager to help assist you with finding a provider. And if you're on Medi-Cal, you can call the number on the back of your insurance card. And if you don't have insurance, you can call the county behavioral health center. They can also assist with Medi-Cal as well. So other ways that you can find, next slide. Okay. Other ways that you can find, other ways that you can find treatment. Some employers offer employee assistance programs, so check with your HR department. Schools and school districts often share resources out in the community as well. I know NAMI is a strong part of the school network. You can call the County Behavioral Health Navigator Program, who can provide peer guidance on local wellness services. And then you can also call the Q Corner, which is for LGBTQ resources. And if you're unsure where to start, you can always call the NAMI helpline, which is listed below, 10 a.m. to 6 p.m., as you know, and staff can guide you through ways to access treatment and providers, and will support navigating you through your mental health care. So now I'll just pass it over to Shalini, and she'll educate us about mental health parity laws and how you can advocate for mental health rights and help the community that you work with on that.
Thank you, Sonali. I will be talking about laws and regulations pertaining to mental health and what your rights as a consumer are in accessing mental health. So this slide just lists the laws where mental health parity regulations reside. This is a list of both federal and state laws in place that provide legal protections and regulate standards. The parity laws require, and these are found, all of these are here, they require that your benefits for mental health and substance use conditions be equal to coverage for other types of healthcare. And I will be talking about parity more in the presentation as we go along. So this slide is specifically for what your rights are in California. In California, okay, one moment. California law requires that mental health and substance use disorder services be required benefits. And they be covered when they are medically necessary. Medically necessary is something which is needed to diagnose or treat a condition, disease, or illness, or its symptoms, and which meets the accepted medical standards. So the law defines medical necessity standards for providers to use. They cannot come up with their own medical necessity standards. Medical necessity determinations have to be consistent with accepted standards of care as determined by the American Medical Association. The sources of the accepted standards of care, they're found in things like scientific studies, medical literature, recommendations of nonprofit healthcare providers, clinical practice guidelines, specialty federal and government agencies. Mental health and substance use disorder services, they are required insurance benefits. So health plan, again, must cover treatment for both mental health and physical conditions that are medically necessary. For example, as an example of medical necessity, you just can't receive insulin because you ask for it. So tests are required to show that your body is not able to use or produce insulin sufficiently. A test would show that you have diabetes, which proves there is medical necessity for insulin as the treatment. The other California law that under California law, it requires that the health plans must provide you appointments within a certain time. And I will go over this in the next few slides. Because there are standards for timely access to care. The law again requires that the coverage for mental health and substance use conditions be equal to your coverage for other types of healthcare. This means what a health plan covers must be the same for mental health and medical treatment. Again, this is what parity is. It does not mean that the plan have to cover or provide all the same services. Each plan has their own services, but for whatever they do provide, it has to be the same for their mental health as well as the medical side. So the health insurances, for example, insurers, for example, cannot impose less favorable or more restrictive limits on mental health or substance use benefits than those for physical health conditions. So what must be the same or at parity. As you can see, there are financial requirements like deductibles, co-pays, co-insurance, those out-of-pocket costs that have to be the same on the medical side as well as the mental health side. Similarly, for example, the number of days you stay in a hospital or the number of visits you have with the provider or how frequent the treatment can be has to be the same on the medical side as on the mental side. So for example, if your plan offers unlimited doctor visits for a chronic condition like diabetes, then it must also offer unlimited visits for a mental health condition such as depression or schizophrenia, if that's what is medically necessary. Like with medical care, health plans must use nationally recognized standards in determining treatment coverage. Health plans must use same medical management standards for both mental health as well as medical care. And if the medical management standards are different, they must use a same process in deviating from the standards of care for both the mental health side as well as the substance as the physical side. And again, they can't just develop standards on their own. And these medical management standards, they include standards that they develop for network benefits, for pre-authorization requests, for prescriptions. For example, for pre-authorization, the requirements must be the same for mental health as what's required for medical surgical benefit. Meaning a plan can't require pre-authorization for a psychiatry visit if it doesn't for an orthopedic visit. And it will cover, and I'll cover more as we go further in the presentation. Same for prescriptions. If a plan follows professional guidelines for dosage limits for mental health substance use prescriptions, then it has to follow the professional treatment guidelines for excuse me, it's the other way around. If it follows the professional guidelines for dosage limits for the medical surgical prescriptions, then it has to follow the professional treatment guidelines for mental health and substance use disorders as well. Same for experimental or investigative treatments. They have to be done again, the determinations have to be done again with the same standards as for the medical health, mental health substance use disorder as for medical surgical. There can't be an exception only for medical surgical side and not have an exception for the mental health substance use disorders. Again, also the plans are not allowed to limit treatment to short-term or acute treatment only. So in short, what that means is that the terms and conditions have to be the same on both the mental health side as well as the physical side. And this slide talks about the access requirements and standards for care. In California, and what you have here is a screenshot of the flyer from developed by the Department of Managed Healthcare. And this explains very clearly what the treatment timely access guidelines are. The plans have 10 business days to provide you an appointment with a primary care physician and 15 business days for a specialty appointment. And this is what you want to note is for mental health appointment, which is a non-physician appointment, they must provide you an appointment within 10 business days. And also same for the follow-up appointments, they must provide you non-physician follow-up appointments within 10 business days. And health plans therefore must ensure their network of providers, including doctors, can provide enrollees with an appointment within the specific number of days or hours, which in other words means that they must have adequate network of providers, sufficient providers in their network to be able to provide appointments within these guidelines. So besides the timely access guidelines, there are distance guidelines as well. The provider that you see has to be within 15 miles or 30 minutes from where you live or work. And then you also must have the ability to contact your health plan via phone 24/7, and interpreter services should also be coordinated if you need them. This again is another picture of a flyer developed by the Department of Managed Healthcare. And it says the laws that require all state-regulated commercial health plans to cover all mental health and substance use conditions at the same cost as physical health conditions, and they must cover the full spectrum of all medically necessary treatment. Coverage of the full range of all medically necessary treatment again, in all settings, like inpatient, outpatient, emergency, and so forth, in network, out of network. So there are all these different classifications, and they must cover all the necessary treatment within various classifications. And for example, this includes when medically necessary sessions with a therapist, medication to manage your condition, outpatient intensive treatment, inpatient residential treatment. Now I have examples here for access to care issues that a person may encounter or a beneficiary may encounter. And the first one is, I can't find a provider in my health plan's network that is accepting patients, or no one can see me for a month. So what can you do as a consumer or as a beneficiary? So as I just talked in the previous slide, the plan must provide you with an appointment with a provider within 10 business days. If you can't find a provider within 10 business days, you can call the plan and let them know, and you can request them that they help you find a provider. My health plan limits the number of visits with my psychologist, but I don't have the same limit with my doctor. Plans cannot do that under parity because it's imposing a limitation on the mental health services, but it's not the same doing that with the medical side. In this case, you would call your health plan and you can file a complaint. The next one is, my health plan did not pay for my behavioral health services. Law requires the plan to provide an appeal process for denial of benefits. If they didn't pay, which means that they denied you benefits, the plan must have an appeal process in place so that you can appeal that denial. So you would call your health plan to file an appeal. If you don't know what to do, just call your health plan, or you can also call California Department of Managed Healthcare, and they can direct you to our agency, which is Bay Area Legal Aid, and we can certainly advise you what to do. So these are the steps here of things you should know and the steps you should take. Understand your rights, which is what you're doing in this presentation. And anytime an insurance company denies or refuses service that is medically necessary, you can file a complaint or a grievance with your health plan and follow it up to Department of Managed Healthcare if you're not satisfied with the plan. So you have to understand your rights. If you're concerned about the care you need or getting, contact the health plan. And then you understand your health plan's grievance and appeals process. That's actually found in your member handbook. If you don't have it, you can certainly call the customer service or the number on the back of your card and ask them how to file an appeal or a grievance. If you decide you can submit the appeal or a grievance to your health plan, you can do so verbally or in writing within the time frame outlined by your health plan and participate in their grievance process for the required number of days. What that means is when you file a grievance, you only have a certain time limit in which to file a grievance. For most plans, that will be listed in your evidence of coverage. It's usually 30 days. Some plans may have 60 days. Once you do that, you must wait for them to respond to your grievance. Again, they require a response within 30 days. If you are not satisfied with the response provided by your insurance, you can escalate the issue to the California Department of Managed Healthcare. You can also escalate it to the Department of Managed Healthcare if your plan does not comply with the 30-day timeline to respond. At that point, your internal appeals process is deemed exhausted. So you don't have to wait for a response. You can just go ahead and escalate it to the Department of Managed Healthcare. So this one just talks about how to that you can submit your complaint to Department of Managed Healthcare online, by mail, or a fax. Timelines are important. You must submit the complaint within 180 days of the plan's decision. Once you submit your complaint to the department, they will review your complaint and notify you of your decision within a specific time frame, depending on the type of the complaint. If the decision by the health plan is overturned, DMHC will instruct the health plan to follow the decision and provide the services. So that's the final decision. The health plan must follow the decision rendered by the Department of Managed Healthcare. And again, here are some important tips to remember. Review your member handbook or your benefit information or evidence of coverage. They're all the same thing. If you don't have it, usually it should be found online. If you don't have it, you can call your member services and request a hard copy. They should mail you one, or they should give you a link where you can access that. You should also try and know the timelines and the deadlines for filing any complaints and appeals. Always keep a copy of all the documents that you submit. Document all the calls in writing, and then get your denial in writing and keep it. So most plans are required to give you a denial in writing. So that's what's the basis for filing a plan appeal and escalating it further. This slide lists the local resources, NAMI, that offers support. Okay, sorry. That offers support and guides community members to mental health resources, such as finding a provider. That's the website for the NAMI, and then you have the NAMI helpline here. You can always call us, Bay Area Legal Aid. We offer free legal advice on health access related issues, and you can call our hotline at 855-693-7285, Monday through Friday, 9 to 1. Then there's the California Department of Managed Healthcare. If you have issues, you can call them, and their number is listed as well, 888-466-2219. And you can also call California Department of Insurance. Some very slight distinction between these two. Some plans are regulated by California Department of Insurance and some by the Department of Managed Healthcare, which is DMHC. You must file your escalation complaint to the correct department. Even if you don't, that's fine. They redirect the complaint to the right department. Some plans, most California plans, are regulated by the Department of Managed Healthcare. And then this slide is just questions. What challenges, if any, are you currently facing? Are there any challenges you're facing that were not addressed here? And last slide, thank you.
All right. Thanks, Shalini. Thanks, Sonali. Is it possible to unshare the slides? Then I think everyone can see you, and then we can get started with the Q&A. As a reminder, please post your questions in the Q&A section. And I do see some questions here. So let's get started. So the first question is, my son with bipolar stopped taking his medication and went into the maniac state and delusion for more than 6 months. I really wanted him to be treated, but he's not aware of his illness and refused treatment. He's in jail for almost 2 months and court has been processing. He's still refusing to consent and medication in jail after the doctor's assessment. I gave AB 1424 form and family input to the clinician in jail and public defender. My son's symptoms seem getting worse. he's not in the mental health court yet, even though we requested all along. I'm pretty frustrated about the legal system. I wonder if my son needs to wait to go to the state hospital. Is he eligible to be placed in the local behavioral hospital and then medication management residential care home later, etc.? How about getting a private lawyer? Please advise.
So our office does not deal with custody issues. You can get a private attorney. My understanding is that they do provide mental health substance abuse treatment in custody, and they should provide it. If the patient is not consenting, I don't know how the professionals can override it. There is a limited period of time where they can force a treatment, but again, that's something out of our practice areas, and I won't be able to advise you on this.
Okay. All right. So the next question is, how can one get past the challenges faced by physician who put the responsibility on the patient to just stop marijuana use? What does the law say about the use of marijuana, since it's legal in California, in relation to treatment in a rehab center?
Okay. So in general, doctors can write an order, but they can't make the patient comply. So compliance part is something that the patient is required to do. So there's no one can force a patient to comply. So there's not much you could do. And again, that's in terms of having like a patient comply with force or against their consent. I am not, that's again something out of our practice area, and I can't speak for that. But certainly patients cannot be forced to comply with the treatment if they don't want to.
All right, thanks for answering that question. There's another question here that just asks, will the slides be shared? Apart from like, that's up to the presenters, but we also live stream on YouTube. So if you want to revisit the slide, that's another way to do it. I'll share the link, but I'll leave it to the presenters if they feel comfortable sharing the slides or not.
Yeah, we can definitely share the slides. We'll share them with you, Rovina, if you wanted to share it with the group. And then also we're going to try to, we can share where we're going to post the slides and some additional resources that we're working on, so that you don't have to rely on the slides, but you have a tip sheet on hand. So
Thanks, Sonali. Harika, if you want to send me an email so that I have your email address, and then once Sonali shares the slides, I'll send it to you. Okay, perfect. Any other questions? There's another question here. Okay. There's a follow-up question about the marijuana use. She says, actually, my son has been asking to be placed at a rehab center.
And this is in an outside facility, or was that in a
member, do you want me to enable speaking for you? Do you want to ask the question live?
I can, in the meantime, I can just address at least the part of that. So any treatment that the patient wants, the doctor has to order it. So if he is wanting in a residential treatment, that would have to be authorized or be prescribed by the doctor based on medical necessity. And if that is the most useful treatment for the patient. So that would primarily be a decision from the doctor to refer to inpatient facility and then go from there. Let's say that the doctor does refer the patient to the inpatient facility, but the insurance does not authorize that. And that's where your appeals process comes into play. So you can, that's like a denial of a benefit that was denial of a benefit to the beneficiary or the consumer. At that point, you can go ahead and file a plan appeal for the denial of the inpatient facility treatment. If you are not satisfied with the response, let's say they approve it, then you don't have to do anything further. If they don't approve it, you can certainly escalate it to the Department of Managed Healthcare. Again, be mindful of the timelines. You only have certain time to file an appeal, usually 30 days or 60 days, depending on your plan, and then escalating it to the Department of Managed Healthcare within 180 days.
Thank you very much. The problem starts with the doctor. The doctor doesn't want to, send him to the rehab center because she always tells him to stop it, And the other thing we are facing, I asked her, is it because marijuana is legal in California? Because we always face the problem starting from the physician's office.
You can certainly try asking for a second opinion and see if another doctor is of the opinion that the patient needs to be referred to the inpatient facility or a residential facility. But certainly that's the doctor's judgment whether to make that referral or not.
All right. Thank you very much. Thank you, Ravina.
Thanks. Okay. I have some more questions here. Let me pull it up. Okay. What can I do if all mental health treatment providers on my insurance in-network list are not accepting new patients and I do not have out-of-network benefits?
Yeah, so per California law, timely access, if you request an appointment with a non-physician mental health provider, they must provide you an appointment within 10 days or within 15 days. In practice, what that happens is when that happens, you call your plan and they'll give you a list of providers. And usually people go down that list and find out none of them work. The numbers don't work, or it's the wrong number, or the provider is not accepting it, or it's not even a part of the plan. So you do have to go down that list and you can find a provider, go back to the plan and tell them, this is what you provided me and I complied with your suggestion and I have not been able to find a provider, so please help me find a provider. They'll again give you a list. That's fine. In practice, that's what happens. But at that point, if they can give you a provider, you as a consumer can say, well, look, I've already asked you and you have not been able to provide me a provider. It's already passed the timely access guidelines. Please make me an out-of-network referral because you're not able to comply with the timely access guidelines. If they deny that, you can file a plan appeal that your out-of-network referral was denied. And again, if they do deny your out-of-network referral authorization as well, then you escalate it to the Department of Managed Healthcare. Usually the Department of Managed Healthcare says if in 10 days you're not able to find a provider, that's a violation of the timely access guidelines. So you could escalate it up to the Department of Managed Healthcare at that point. But in practice, might be a good idea to put in some more effort. And it is an effort, and it's sometimes not a productive effort because you're going down that list of providers that they provided you and not able to find a provider. So it's a good idea to just go down that list and make an effort and then go back to the plan and ask for an out-of-network referral.
Okay, great. Thanks for answering. There's another question here. Is there information that is important to collect and record when considering and leading up to conservatorship for your adult child?
Yeah, so we're not able to advise on conservatorship. Again, that's something out of our practice areas. You may want to consult a wills and trust attorney or somebody who deals with conservatorships.
Okay. Thanks for answering. The other question is also about conservatorship, so I will not ask you the question. Let's see if there are any other questions here in the chat that I'm missing, or if anyone wants to raise their hand to ask a question, feel free to do that. Okay, I think I do see a hand raised. Here you go, Neeti.
Okay. Can you hear me?
Yes.
Okay, so my son was under conservatorship, and then they released him. He's not under conservatorship now. He's in some unlicensed facility now. He's with Indian Health Center, but I don't know, for the last 2 months, I don't know where he lives, whether he's still in treatment or he has stopped taking the treatment. The case manager doesn't tell me anything. I know if he doesn't give the consent, I cannot find out about his medication, about his treatment or anything. But can they not even tell me where he is? Can I not even see my son?
I don't know the answer to that in general, and I can advise you. And I just want to put this out as a disclaimer. Whatever I'm saying is not advice, it's general information. So if you want specific advice, please call our hotline and then I can advise you. In general, conservatorship issues we don't advise in our it's out of our practice areas, but consent is something that does need to be provided in general. And so without consent, because of the HIPAA laws, healthcare professionals are not able to release any information about anyone unless they have a valid consent.
Okay, thank you.
In addition, Neeti, I don't know if you've already called our NAMI helpline number. But I can give that to you again. If you want to call a NAMI helpline number, our helpline staff should be able to support you in some way, provide you with some resources. And if you have a pen right now, I can give it to you.
I have the helpline number. I think I will call them tomorrow.
Please call them, because they have several resources and they can support you with this to see how you can be involved as a family member with your son's treatment.
Thank you. Thank you very much.
Yeah, thanks, Neeti. Okay, any other questions? I don't see any hands and I don't see any questions. So I think Sonali has just posted in the chat a post survey. If you can just all of you can just fill the post survey, that'll be really helpful. And let's give it about a couple of minutes while you're filling up the survey, and I'll keep an eye out if there are any questions or any hands that have been raised. Okay. All right, I think this brings us to the end of our June general meeting and the presentation. We will have our next general meeting in September. And we usually don't have a general meeting in the summer. But I hope that all of you can join us for the NAMI kickoff. And before we take off, I really want to thank you, Shalini and Sonali, for presenting tonight and giving us all this information about know your rights, about know your mental health rights. I think this is very useful information, very helpful, and all of us should be aware of. And thank you for working so hard on creating this presentation and coming tonight and answering all the questions. So I hope you have a good evening. And thank you, everyone who joined us this evening, and hope to see you at the kickoff and also at the walk. Okay. Bye, everyone.
Thank
Good
you.
night. Bye, Shalini. Bye, Sonali.
Bye.
Thanks so much.